You wake up in the morning just like any other day. You stretch, maybe feel a little off, maybe notice something small, something easy to dismiss. And that's exactly why it's dangerous. Because some of the deadliest tumors don't scream for attention. They whisper, quietly, subtly. They show up in the first 10 minutes after you wake up and then disappear just enough for you to ignore them. By the time most people realize what those signs meant, it's already too late. I'm going to walk you through 6 morning symptoms that could be warning signs of something far more serious happening inside your body right now. Not in a year, not someday. Now, this isn't guesswork. This is based on clinical observations, oncology data, and patterns doctors see again and again in patients over 50, people who thought they were fine until one day they weren't. And here's the part you need to understand. These symptoms don't feel like emergencies. They feel harmless. That's what makes them deadly. Stay with me, because symptom number 1, yes, the final one we'll get to, is the one most people ignore right up until diagnosis. But first, we start with number 6, and this one alone has been quietly linked to a significant percentage of late-stage discoveries. Before we begin, I want you to do something simple. Tell me your age in the comments below. Just the number, nothing else. Because once you cross 50, your risk profile changes dramatically. Your body doesn't repair the same way. Cells mutate more easily. Warning signs become more subtle and more dangerous. Now let's begin. The 6th morning symptom you should never ignore is waking up with unexplained fatigue, even after a full night's sleep. This isn't the kind of tiredness you feel after a late night or poor sleep. This is different. You wake up, and it feels like you never rested at all. Your body feels heavy. Your energy is gone before your day even starts. Here's where it gets serious. Tumors, especially in early development, can alter your body's metabolism. They compete for nutrients. They release inflammatory signals called cytokines, which disrupt normal energy production. In simple terms, your body is being drained quietly. A study published in cancer research journals found that over 60% of patients diagnosed with certain internal tumors reported persistent, unexplained fatigue months before any other symptom appeared. But because fatigue is so common, especially after 50, it gets brushed off. Let me tell you about James. At 58, he was active, disciplined, and healthy by all visible measures. But every morning, he felt drained. He blamed aging, maybe stress, maybe sleep quality. Weeks turned into months. By the time he went for a checkup, doctors discovered a tumor that had been silently growing, feeding off his body's energy the entire time. His first sign wasn't pain. It was fatigue. As you age, your body already produces less cellular energy. So when something starts draining that limited reserve, the effect becomes more noticeable, but also easier to misinterpret. Here's what you should do starting tomorrow morning. If you wake up tired more than 3 days in a row despite sleeping well, don't ignore it. Track it. Write it down. Notice patterns. And here's a powerful synergy tip most people miss. Pair your observation with your hydration and nutrition the night before. Tumor-related fatigue doesn't improve significantly with rest, water, or a good meal. Normal fatigue does. That difference could be the clue that saves your life. Now let's move to the 5th symptom, and this one is even more deceptive. Waking up with a dull, persistent headache. Not a sharp migraine. Not something that knocks you down. Just a steady, nagging pressure that's there when you wake up and sometimes fades as the day goes on. It's easy to blame your pillow, your neck, maybe dehydration. But here's what most people don't realize. When tumors develop in or around the brain, they can increase intracranial pressure, especially when you've been lying down for hours. That pressure builds overnight, and when you wake up, your brain feels it first. According to neurological studies, early-stage brain tumors often present with morning headaches as one of the first symptoms in nearly 45% of patients. And because the pain isn't extreme, it gets ignored. Let me tell you about Sarah. She was 62, independent, sharp, still working part-time. Every morning, she noticed a slight headache. Nothing severe, just enough to be annoying. She started changing pillows, adjusting sleep positions, drinking more water. It helped a little, but the headaches kept coming back. Months later, after a moment of dizziness sent her to the doctor, imaging revealed a mass that had been slowly growing, increasing pressure inside her skull every single night. That small headache was never small. It was a signal. As we age, The brain becomes more sensitive to pressure changes. Blood flow regulation shifts. That means even subtle abnormalities can create noticeable symptoms if you know what to look for. So here's your action step. If you wake up with a headache more than twice a week for several weeks, don't self-diagnose. Get it checked, especially if it improves after you stand up or move around. That pattern matters. And here's the synergy tip. Pay attention to whether that headache is paired with even slight nausea, blurred vision, or balance issues when you first get out of bed. That combination significantly raises concern because symptoms rarely come alone. They stack quietly until they become impossible to ignore. And by then, the window for early detection may already be closing. We're just getting started. Next, we move to symptom number 4, and this is where things begin to escalate. Now we move to the 4th morning symptom, and this is where things begin to escalate in a way most people never expect. You wake up, and your voice sounds different. Maybe it's slightly hoarse. Maybe it feels strained, like you've been talking all night, even though you haven't said a word. You clear your throat, take a sip of water, and after a while, it seems to improve. So you ignore it. But that subtle morning hoarseness could be your body signaling something much deeper, especially when it happens repeatedly. Here's what's happening beneath the surface. Tumors affecting the throat, thyroid, lungs, or even the upper chest can press against or interfere with the nerves that control your vocal cords, particularly the recurrent laryngeal nerve. When you lie down for hours during sleep, fluid shifts and tissue pressure increase in those areas. By morning, that pressure can temporarily affect your voice. Clinical data has shown that persistent hoarseness lasting more than 3 weeks is one of the early signs in a notable percentage of throat and lung cancer cases, especially in adults over 50. But here's the dangerous part. Because the symptom improves during the day, people assume it's nothing serious. Maybe dry air, maybe aging vocal cords. Let me tell you about Henry. At 65, he had never smoked a day in his life. He considered himself low risk. But every morning, his voice sounded rough, like he had a mild cold that never fully arrived. His family noticed. He laughed it off. Weeks passed, then months. Eventually, after a persistent cough joined the picture, he saw a specialist. Imaging revealed a growth pressing against his vocal nerve. His first warning sign wasn't pain. It was a quiet change in his voice every single morning. As you age, tissues naturally lose elasticity. Nerve sensitivity changes. That means early interference from abnormal growths can show up sooner, but in subtle ways like this. Here's what you need to do. If your voice sounds hoarse, weak, or strained in the morning for more than 2 weeks, don't wait for it to get worse, especially if it's not tied to a cold or infection. And here's your synergy tip. Pay attention to whether that hoarseness is paired with difficulty swallowing, a sensation of something stuck in your throat, or even mild ear discomfort. These overlapping symptoms can point to deeper structural issues, because again, these signs rarely appear alone. Now we move to symptom number 3, and this is where the body starts sending signals you can actually feel with your hands. You wake up, go about your routine, and notice swelling. Maybe it's in your face, around your eyes, in your neck. Your fingers feel tighter. Your rings don't slide on the same way they used to in the morning. At first, it seems harmless. You assume it's fluid retention, maybe something you ate, maybe just part of getting older. But persistent morning swelling can be a warning sign of something obstructing your body's normal fluid flow, especially the lymphatic system. Here's why that matters. Your lymphatic system is responsible for draining excess fluids, filtering toxins, and supporting immune defense. When tumors develop, particularly in the chest, neck, or abdomen, they can compress lymph vessels or nodes, causing fluid to back up. This often becomes most noticeable in the morning because you've been lying down for hours, allowing fluid to redistribute. Studies have shown that unexplained swelling, especially in the face or upper body, has been linked to underlying tumors affecting lymphatic drainage in a significant number of late-diagnosed cases. Let me tell you about Linda. She was 59, recently retired, enjoying her mornings. But she began noticing puffiness around her eyes when she woke up. Some days her face looked slightly swollen. It would improve after a few hours, so she didn't think much of it. She changed her diet, reduced salt, drank more water. Nothing changed. Months later, after experiencing shortness of breath, she underwent testing. Doctors found a tumor compressing major lymph vessels in her chest. That swelling was never about salt. It was about blockage. As we age, our lymphatic efficiency naturally declines. That makes it easier for even small obstructions to create visible symptoms, especially after long periods of rest. Here's your action step. If you notice consistent swelling in the morning, especially in your face, neck, or hands, that doesn't clearly link to diet or improves only slightly during the day, get it evaluated. And here's the synergy tip. Check if that swelling is accompanied by a feeling of tightness in your chest, difficulty taking a deep breath, or visible veins becoming more pronounced in your upper body. These combined signs can indicate restricted flow, because once again, your body is sending a message. The question is, are you listening? Before we move to the next, and one of the most overlooked symptoms, I want to pause for just a moment. If anything you've heard so far feels familiar, if even one of these signs made you stop and think, then this video could genuinely change your future. Make sure you're subscribed, not for me, but for yourself. Because the reality is, after 50, your body speaks differently. The warning signs are quieter, the timelines are shorter, and the cost of missing them becomes much higher. Every week, we break down real, science-backed signals your body gives you, so you can act early, not react late. Now let's continue. We move to symptom number 2, and this one is often dismissed as just part of aging, until it's not. You wake up, and you feel stiff. Not just normal stiffness. Not just, I slept wrong. This is a deeper, more persistent kind of stiffness, often in your back, hips, or even your chest. It takes longer to loosen up. Movement feels restricted. Something just doesn't feel right. And here's where it becomes concerning. Certain tumors, especially those affecting bones, connective tissue, or nearby organs, can create inflammation or direct pressure that manifests as stiffness, particularly after long periods of inactivity like sleep. During the night, when your body is still, these effects can intensify. By morning, the stiffness is at its peak. Research has shown that unexplained, persistent stiffness, especially when not tied to physical activity or injury, has been reported in a meaningful percentage of patients later diagnosed with bone-related or metastatic cancers. But again, it's subtle. It doesn't feel like a crisis, so it gets ignored. Let me tell you about Robert. At 67, he started waking up with stiffness in his lower back. He assumed it was age, maybe arthritis. He tried stretching, light exercise. It helped slightly, but the stiffness kept returning. Every morning. Eventually, after noticing a dull ache that didn't go away, he sought medical advice. Imaging revealed lesions in his spine, caused by a tumor that had been developing silently. His body had been warning him. Every morning. As we age, joint stiffness becomes common. That's what makes this symptom so dangerous. It hides in plain sight. So here's what you need to watch for. If your morning stiffness is persistent, worsening, or not clearly linked to activity, don't assume it's just aging, especially if it's localized and doesn't improve significantly with movement over time. And here's your synergy tip. Pay attention to whether that stiffness is paired with unexplained weight loss, fatigue, or pain that wakes you up at night. That combination should never be ignored, because by the time stiffness turns into pain, the condition behind it may already be advanced. And now, we arrive at the final symptom, the one most people dismiss, the one that seems the least threatening, but often carries the most weight. Symptom number 1. Now we arrive at the symptom that changes everything, the one that hides in plain sight, the one most people dismiss, the one that doctors often wish patients had taken seriously sooner. You wake up in the morning and you feel full, not satisfied, not comfortably nourished, unnaturally full. You haven't eaten yet. Maybe you've just had a glass of water or nothing at all, and yet your stomach feels tight, heavy, bloated, almost as if you've already had a large meal. It doesn't make sense, so you ignore it. But this is one of the most quietly dangerous warning signs your body can give you. Because that sensation of early fullness, especially in the morning, has been repeatedly linked to tumors affecting the digestive system, particularly the stomach, pancreas, and ovaries. Here's the science behind it. Tumors in the abdominal region can physically occupy space, press against the stomach, or disrupt normal digestive signaling. They can slow gastric emptying, alter hormone release, and create a false sense of satiety, meaning your brain thinks you're full, even when you're not. And because this sensation is subtle at first, it often goes unnoticed until it becomes impossible to ignore. A clinical review found that a significant percentage of patients diagnosed with upper abdominal cancers reported persistent early satiety weeks or even months before diagnosis, but fewer than half recognized it as a warning sign. Now let me tell you about Olivia. She was 61, active, careful with her diet. She prided herself on staying healthy, but she began noticing something strange. Every morning, she felt like she had already eaten. Breakfast became difficult. She would sit down with a small portion of food and feel full after just a few bites. She thought it was a digestive issue, maybe acid reflux, maybe stress. Weeks passed. Then came mild bloating, then a slight drop in appetite. Nothing dramatic, nothing alarming, until one day, the discomfort didn't go away. Medical tests revealed a mass in her abdomen that had been slowly growing, pressing against her stomach, altering how her body perceived fullness. Her earliest warning sign was that quiet morning sensation. I feel full. That was it. No pain, no emergency, just a whisper. As you age, your digestive system naturally slows down. Hormonal signals change. Appetite fluctuates. That's exactly why this symptom is so often misinterpreted. But here's the difference you cannot afford to miss. Normal appetite changes are inconsistent. They vary day to day. Tumor-related fullness is persistent, predictable. It shows up again and again and again. So here's what you must do. If you wake up feeling full, without eating, for more than a week consistently, do not ignore it, especially if it's paired with bloating, mild nausea, or a reduced appetite throughout the day. Track it. Write it down. Notice how often it happens. And then take the next step. Get evaluated. Because early detection here can mean the difference between a manageable condition and a life-threatening one. Now here's the synergy tip that could sharpen your awareness even further. Pay close attention to your waistline, not just your weight. Tumor-related abdominal changes often create subtle increases in girth without significant weight gain. Your clothes may feel tighter around the midsection, even if the scale hasn't changed much. That combination, morning fullness, slight bloating, and a tighter waistline, is not something to overlook. Because when these signals align, your body is no longer whispering. It's trying to warn you. And now, you've heard all 6. Fatigue that doesn't go away. Morning headaches that feel normal. A voice that changes when you wake up. Swelling that comes and goes. Stiffness that doesn't make sense. And that quiet, persistent feeling of fullness. Individually, each one seems harmless. Together, they tell a different story. This is how silent tumors operate. They don't announce themselves. They blend into your routine. They disguise themselves as aging, stress, minor discomfort. And they wait. They wait for you to ignore them. They wait for time to pass. Because time is exactly what they need to grow. But here's the truth you need to hold on to. Catching these signs early doesn't just improve outcomes. It can completely change them. When tumors are detected early, treatment options expand. Survival rates increase dramatically. In some cases, what could have become life-threatening is stopped before it ever reaches that point. You are not powerless here. You are not guessing. You are observing. And that awareness is your advantage. So starting tomorrow morning, I want you to do something different. Pay attention, not with fear, but with clarity. Notice how you feel when you wake up. Notice the patterns. Notice what repeats. Your body is communicating with you every single day. The question is whether you're listening closely enough to hear it. And if even one of these symptoms feels familiar, don't wait. Not another week. Not until it gets worse. Act now, because the earlier you respond, the more control you keep. And that control can mean everything. If this opened your eyes, even a little, then stay connected. Subscribe and turn on notifications so you don't miss what comes next. Because the reality is, your body gives you signals long before disease takes hold. And the more you understand those signals, the better your chances of staying ahead of them. There's more you need to know, and we're just getting started.